Hi everyone, today I will be talking about dysarthria, what it is, its prevalence, its development, strengths and weaknesses of those with dysarthria, and possible interventions for patients with dysarthria. First, what is dysarthria? It is a motor speech disorder caused by a neurological impairment affecting motor execution. There are 6 classifications depending on the neurons damaged: spastic, flaccid, hyper and hypokinetic, ataxic, and mixed. Some common symptoms of dysarthria include hypernasality of the voice, swallowing and drooling problems, and overall intelligibility of speech due to poor articulation. Dysarthria makes up 46.3% of diagnoses of acquired neurogenic communication disorders, making it the most prevalent. It is a common secondary disorder to things such as Parkinson's, ALS, CP, and stroke. Physical development is normal in patients with dysarthria unless another disorder is present. However, communication development is inhibited since patients cannot produce proper speech sounds, and social development is inhibited due to the lack of linguistic opportunity. Literacy skills are impaired because phonological processing necessary for reading cannot develop normally in those with congenital dysarthria, in which the impairment took place before or during birth. With acquired dysarthria, the damage happens after the system is fully developed, so literacy has developed normally. One main strength is letter knowledge, which is clearly necessary for reading and writing. Weaknesses, however, include execution and articulation of speech, and a lack of coordination of motor control of muscles necessary for speech. Other weaknesses include phonological awareness, or the awareness of sound structures of words, general language skills, and auditory discrimination, which is the ability to discriminate between letter sounds, all necessary for reading and writing, and sounding out words and sentences. Some interventions for dysarthria include the speech systems intelligibility treatment, Lee-Silverman voice treatment, and general speech therapy. All focus on intelligibility and articulation of spoken words and sentences. On the other hand, integral stimulation and behavioral communication interventions focus on visual attention, articulation gestures, memory, and reading aloud. Overall, dysarthria, a neurological impairment, affects many parts of both literacy and communication, whether it's congenital or acquired. However, through intervention, intelligibility of speech, articulation, and muscle control can be improved.